Hi, I'm Josh Akers, the manager of the Kelley-Ross Pharmacy Group Clinical Pharmacy Institute. We love it when we get to talk about our in-home medication coaching program, but even more than that, we love it when one of our partners will talk about it for us. So I want to introduce you to Ann Casey, the Administrative Director of the Virginia Mason Heart Institute. We've enjoyed a fantastic partnership with our in-home medication coaching program, helping their congestive heart failure patients after they discharge from the hospital.
One of the things we're proud of at Virginia Mason is the work that we've done for our heart failure patients. And this is a high-risk, vulnerable population that has a high incidence of being readmitted to the hospital, and a lot of work has gone into seeing what we can do to improve their outcomes. And so at Virginia Mason, we've done a lot of things. We've worked on evidence-based practices, bundled care, we've worked on appropriate discharge, and the national rate for readmissions is around 24–25%. And it varies across the country between the high hospitals, high in the 10%, best of the hospitals in the country, between 22 and 27%. And we've done focus works. We've received awards for the work we've done with heart failure. And prior to that, our admission rate was about 24%. And with all that work now, it's about 22%. So we really haven't found what it is that we can really improve the outcome for these heart failure patients. So we decided we needed to look at how could we make an impact on these patients. So as we looked of how we might want to approach this issue, we thought pharmacists would be the best group to do this. And we had been on a webinar where we had heard that there was data out there that showed that when nurses went into the home, they actually saw an increase in readmissions. And when they had a pharmacist or a PA go into the home, they had a decrease in readmissions. And we thought, that's interesting. Let's take that information and let's see if we can apply it with ours. The pharmacist has the skill set, and when they're in the home, they're actually able to work with these high-risk patients that have polypharmacy in real time and have the skill set that's needed for those patients in their home, that they can set them up to be more successful in their home care. I think one of the things that has made our Heart-to-Heart program so successful is we were able to get Kelley-Ross pharmacists onto our electronic medical record. And that's something that's a little unusual as you're working with partners. So typically, if we have someone that's out in the home, they're either going to try to call or fax us information about that patient. But by having the pharmacist in the home and be able to put their notes directly into our electronic medical record, where all providers across the organization can view those, and then they can communicate directly through what we call Cerner messaging or directly through our system, then we're really taking care of that patient real time. And I think that has been part of why we've been so successful with this program. So now that we've done our first 30 patients with our Heart-to-Heart program in partnership with Kelley-Ross, we had a chance to look at the data for these patients, and I think all of us were amazed at what we've seen so far. So of those patients, we've seen, I think it's 274 medication-related problems that needed to be addressed, whether it's efficacy or potential drug reactions or just transition issues. We've also seen over 300 interventions that the pharmacists have made that have been done in real time with these patients in their home. And with all of this work, we've also seen that as they contact the physician, that over 70% of the time the physician is taking that recommendation and changing that plan of care as the pharmacist is seeing it in real time. So really affecting our patients' outcome and their quality of care. And then most exciting, the typical, or what we've seen nationally as far as the readmission rate being in the 20s, mid-20s. To date, with our patients that we've had in this study, our readmission rate is 6.6%. That's amazing.